In the following cases, extensive scarring of the tympanic membrane, calcification of the tympanic membrane, we confirm that most of these diseases are detected and diagnosed by this important clinical sign B10 clinical otolaryngology, normal, radiographic, microscopic and surgical, but when making a diagnosis to treat the disease correctly and effectively, a complete clinical history must be taken and knowledge of the patient's antecedents of all types, pathological, traumatic, hereditary, allergic, inflammatory and surgical. It is also very important to conduct a comprehensive interrogation and complete examination in the otology specialty. The diagnosis and treatment of other clinical symptoms and signs, such as hyperthermia, nasal and ear gonorrhea of various types, serous, mucus, purulent, bloody, and cerebrospinal fluid, especially in traumatic injuries and surgical complications. Especially endoscopic sinus surgery and middle and inner ear surgery should be continued. It is also necessary to be humble in decision-making and a wise treatment protocol, and it is wise to rely on a consult expert colleagues and professors from the same specialty if necessary, and request medical and surgical consultations for the rest of the specialties according to the type of surgical condition. The book can be downloaded from the web for details. In short, most diseases of the closed ear such as obstruction of the pharyngeal tube due to various causes, then serous otitis media in its various degrees, serous, mucus, and cerumen, and other diseases such as hematoma of the middle ear and jugular glomus tumor in its early stages inside the middle ear. The right angle changes from right to acute in the early stages of serous otitis media, for example, and with the progression of the pathological mechanism. The angle becomes obtuse to various degrees. In otoscopy with normal examination, we estimate the angle as acute, right or obtuse. And for each closed ear disease, there is a specific qualitative angle that diagnoses this disease in addition to the history and the rest of the symptoms and signs. And practically, we shorten most of the expensive investigations. And we confirm that sign clinically, planning, radiologically and surgically. Thank you and appreciation.